Good morning. Merry Christmas and Happy New Year. I have been receiving many Christmas cards and a fair amount of sympathy cards in light of my brother's passing last week. But I did get one anti-Christmas card, and I guess that would be the letter I received from the Board of Medical Practice last night, late. It was certainly not a Christmas gift I wanted. I think it's important for us to have a conversation. I have said repeatedly, if it can happen to me, it can happen to you. This is the 5th time I'm being investigated by the Board of Medical Practice. So I want to go over it real quickly with you. On October 21st, 2021, I was notified by the Board of Medical Practice that there were allegations submitted against me highlighting the following phrases: spreading misinformation, that I am not vaccinated, that I'm inappropriately recommending against children wearing masks in school, that I am politicizing public health, that I have indicated that we have data that says masks don't do the job, that I've compared vaccines to chemotherapy for cancer, that I've told my followers that hospitals and doctors are falsifying death certificates, that I'm promoting the use of ivermectin, and I'm promoting the benefits of natural immunity. That's what the October 21st response was. I submitted a response, and I said in that response on November 9th the following. I said, "Dear Minnesota Board of Medical Practice, the investigative process we are mutually involved with at this time is bordering on the ridiculous. I have seen no clear evidence that you are being asked to adjudicate a situation whereby patient health care services provided by me have been problematic. Collectively, you and I are being abused by those with a political agenda who would weaponize your agency for purposes outside the realm of your mission." I went on to say, "This is the 5th time you have investigated me in the last 17 months. Heretofore, I have not asked for the identities of my accusers, but I do ask now. It is unfair to me and to you that these accusers can hide behind anonymity and make attacks with no intrinsic personal responsibility or liability for being truthful, deceitful, or whatever." I went on to specifically respond to each of the bullets, but in regards to the question of ivermectin, I said this: ivermectin is an approved medication on the World Health Organization list of essential medicines. I have used this medication for decades, and if patients ask me if they can use it, I consider such requests on an individual basis in light of clinical situations and indications. I believe some significant medical literature has supported possible usefulness of ivermectin in the early stage of COVID-19, and as such, I have written a handful of prescriptions for ivermectin for COVID-19. That was my response. And last night, when I got home, after shopping with the grandchildren, I had this letter from the Board of Medical Practice. In your response, you indicated that you have prescribed ivermectin to some of your patients for treatment of COVID-19. Pursuant to the board's investigation of this matter, please provide the following records. 1 bullet, copies of medical records for the most recent 3 to 5 patients to whom you prescribed ivermectin to treat COVID-19. Then it says, Minnesota State 147.161 Subdivision 3 Minnesota Statute 147.161 Subdivision 3 allows healthcare providers to release medical records to the board under such circumstances. This statute provides, quote, "If no consent form has been signed, the hospital or physician shall first delete data in the record which identifies the patient before providing it to the board." It goes on to say, "This information can be disclosed to the board as a health oversight agency without written consent or authorization of the patient or the patient's legal representative." And then the board comes with this. "I must inform you that as a licensee of the board, you are required to cooperate fully with the investigation into this matter. Failure to cooperate could result in disciplinary action by the board." Why do they want your records? I have said, if it can happen to me, it can happen to you. Friends, this is happening to you. This really isn't about me. Virtually every one of the complaints from the October 21st letter was almost word for word verbiage from tweets on the Twitter platform. Yesterday, same day, I got a request from the University of Minnesota Medical School to participate in a research program. And in there they say, we want you to do some questionnaires for us, and we do not want any indication of the respondents identifying information. And they said, it will be impossible to identify individual participants in the project based on the information they provide. Have you heard that before? It will be impossible. It will be impossible for patient identification to take place. I'm not buying it. I've said over and over, if it can happen to me, it can happen to you. It's happening to you. The Minnesota Board of Medical Practice wants to know why 3 to 5 of my patients have received ivermectin prescriptions. In 2015, Governor Dayton in Minnesota signed legislation called the Right to Try. Subsequently, President Trump signed similar legislation. Representative Nick Zerwas was the lead author in Minnesota. The Right to Try legislation did not deal with already approved medicines. It was trying to provide an avenue of, if you will, one last effort for a patient who is on the way to dying. It was there for the investigational drugs that maybe haven't been able to move along rapidly enough in the pipeline. But the notion, the spirit of the Right to Try legislation was that if patients are traveling towards death and we have nothing to offer, we want to make certain that they have the right to try. That coincides very much with physicians doing off-label prescribing. So let's talk about off-label prescribing briefly. Let's take Flomax. That's a drug that was originally indicated to shrink prostates for men so that they wouldn't pee as often at night and their urinary stream might be more normal and perhaps there would be less post-voiding dribbling. But we found, not through the drug company, but through off-label use, that it can help people spontaneously pass kidney stones. I probably use almost as much Flomax for people with kidney stones as I do to shrink prostates. Another one, off-label, Keytruda, a powerful chemotherapy agent for people with cancer. It works with the immune system, and it's worked well, and it's better tolerated than a lot of our chemotherapy cocktails that we use. But it was approved for a narrow scope of indications initially. But oncologists had conversations with patients, and slowly Keytruda was used in other indications other than what it was specifically approved for. It already had a track record of efficacy in some situations and safety. Keytruda now is used for far more cancers than it was originally approved for because of off-label prescribing by oncologists and conversations with patients. I said earlier today, I will never forsake the patient-doctor relationship. Because without that relationship, which has to be immersed in health freedom and informed consent, that relationship is what drives medicine forward. People 10, 20 years from now will benefit from the conversations physicians have today with their patients. And oftentimes those conversations will lead to off-label use and more growth, more learning. One last example, off-label. 1976, Legion Convention in Philadelphia. People leave the convention, they go home, and they're getting sick. And some of them are dying of pneumonia. Physicians did what they typically would do. They used high-powered intravenous antibiotics. Patients kept dying. We didn't know what was causing it. It wouldn't be for another year that we would actually be able to isolate and identify the bacteria, which has now been called, I think, Legionella pneumophila. But regardless, physicians went with off-label prescribing. Some physicians started trying an old-fashioned antibiotic called erythromycin, and voila, it worked, and patients quit dying. We didn't call an epidemiologist. We didn't call Dr. Fauci. We just kept trying. We had conversations with patients and families. We used erythromycin. That's what we did. But To the point at hand, why does the Board of Medical Practice want your information if you were one of my last 3 to 5 patients treated with ivermectin? Is it something that they want to know about you that might be used against you or might be used against people like you? Do they want to know if you are vaccinated or unvaccinated? Do they want to know if you had been using medical marijuana or CBD products? Do they want to know whether you're on Medicare or a different insurance program? Will they be able to match up the information I provide, even if I, if you will, obliterate your name and your age and even your gender? Will they be able to potentially collude with someone else and find out that because you had these 4 medical problems and you're on these 5 medicines, that they can match that up and they can figure out who you are? The Board of Medical Practice most likely has access to our MIC program, which is the Minnesota Immunization Information Connection, where you can find out if you've been vaccinated against COVID or tetanus or whatever. And patients that are vaccinated in our clinic, that data is submitted to the MIC program in Minnesota. Is that why they want it? You can choose. You can decide why the Board of Medical Practice wants your information. But they want it. The Minnesota Board of Medical Practice, not an attorney, but a board, presumably to determine whether or not the care I'm giving is appropriate. I submitted in my response an article on ivermectin from the International Journal of Antimicrobial Agents. And this is what it says in the abstract. It says, we surmise that this may be connected to ivermectin's ability to inhibit SARS-CoV-2 replication, which likely leads to lower infection rates. However, other pathways must exist to explain the persistence of such an inhibitory effect after serum levels of ivermectin have declined. That was the article I submitted to the Board of Medical Practice. They never mentioned that. They never mentioned my request to know the identity of my accusers. Here's an article from the Washington Post a couple months ago regarding ivermectin. David Boulware, a professor of medicine in the Division of Infectious Diseases and International Medicine at the University of Minnesota, one of our own, said this: just because ivermectin works in the lab doesn't mean that it works in humans, said Boulware, who's involved in 2 ongoing large-scale clinical trials examining the effect of ivermectin on people with COVID. This is a Washington Post article from September of this year. So I click on this article in terms of these clinical trials. And here's what it says. Why is this study being done? To understand if these medicines prevent severe COVID and long COVID symptoms. It goes on to say, COVID-19 increases inflammation in the body, which causes harm. 3 bullet points. The medications metformin, ivermectin, and fluvoxamine are known to decrease inflammatory proteins, cytokines, in the body. They also appear to possibly stop the proteins inside cells that help viruses reproduce and spread. Next bullet. Review of persons who developed COVID-19 while taking metformin suggests that they were less likely to be hospitalized or die from the infection. Smaller prospective studies showed patients giving fluvoxamine or ivermectin were similarly less likely to be hospitalized or die from COVID-19. Third bullet, if we give metformin, ivermectin, fluvoxamine, or a combination of these medications to individuals soon after they develop COVID-19, will it decrease the severity of their symptoms? Will it prevent them from needing hospitalizations? This study hopes to answer these questions. What is involved? The study is 14 days of taking the study drugs or placebo pills twice per day. All of these medicines are FDA approved for both adults and children. You're going to be randomly assigned to one of 6 possible treatment groups: metformin, ivermectin, fluvoxamine, fluvoxamine plus metformin, ivermectin plus metformin, or a placebo. Okay, this is the University of Minnesota study that is quoted in the Washington Post. It says over and over again that there may be value to ivermectin. Here's another article. Ivermectin, a multifaceted drug of Nobel Prize honored distinction with indicated efficacy against a new global scourge, COVID-19. And it goes on to say this. In 2015, a multifaceted drug deployed against some of the world's most devastating tropical diseases received an award. It's the only time in 6 decades a drug such as this was provided the Nobel Award. It says this: since March 2020, when ivermectin was first used against a new global scourge, more than 20 randomized clinical trials have tracked such inpatient and outpatient treatments. 6 of 7 meta-analyses of ivermectin treatment random controlled trials reporting in 2021 found notable reductions in COVID-19 fatalities, with a mean 31% relative risk of mortality versus controls. During mass ivermectin treatments in Peru, excess deaths fell by a mean of 74% over 30 days. This is what I think people need to understand about ivermectin. So, why does the Minnesota Board of Medical Practice want your information? Are they going to point out whether or not you're vaccinated or unvaccinated, whether or not you're medical marijuana or not, whether or not you've had previous or recent sexually transmitted diseases, whether or not you might have some mental health issues, and did they come with COVID or before COVID? We have got to ask ourselves, what is going on here? At the end, in the final analysis, the right to try legislation was responding to patients' very real concerns about not being able to do something that they would want to try before they die. We have done exactly this with COVID-19. We have given patients binary choices. Go home and get better on your own, or wait till you get so sick you go to the hospital. Now we say, well, we've got other treatment programs. Have the vaccines done what we had hoped? Have the vaccines done what we had been told they would do? For that matter, has remdesivir, have any of these? I understand we've got some new oral medicines coming out. I hope they're effective. But this has to do with health freedom. This has to do with informed consent. If a physician and a patient have a real, live, honest, back and forth, non-bullying, non-coercive conversation, can't the patient and the physician come up with an approach based on a lot of the data I just shared? Informed consent means patients need to be informed and they need to consent without coercion. Health freedom means that we get to choose, that we're in charge of our own bodies. We are seeing such a violation of our health freedom. Informed consent has been thrown to the wind, and our privacy rights in regards to healthcare have been violated over and over again because of executive powers, emergency powers. Friends, I've said over and over again, if it can happen to me, it can happen to you. In 1946, Martin Niemöller, after World War II, said something like this: when I didn't speak up when they came for the trade unionists because I wasn't a trade unionist. I didn't speak up when they came for the socialists because I wasn't a socialist. I didn't speak up when they came for the Jews because I wasn't a Jew. And when they came for me, there was no one left to speak up. This is not about this divide of being pro-mask or not pro-mask, pro-vaccine or not pro-vaccine. This is so big. This is government reaching in to your life. They're saying, if you happen to have been one of Dr. Scott Jensen's last 3 to 5 patients treated with ivermectin, amongst a handful of patients who he has treated with ivermectin, your records are going to be forwarded to the state. I will certainly delete names and birth dates and addresses and telephone numbers. And I will most likely delete dates. And I will delete gender. But are you not concerned? Are you not concerned? I will not forsake the relationship I have with my patients. I hope other doctors won't either. But I am conflicted right now. I'm not certain what to do with this Board of Medical Practice response. Up to here, this is my 5th time being investigated. I've not retained an attorney. I've tried to take care of myself just like a normal family doctor would, who's being accused not of poor healthcare service provision, but who is being attacked because of politics. If my wife and I a year ago had not made the decision to run for governor, I do not think that I would be in this situation. But more importantly, you need to think about the situation you're in. 18 months ago, the first time I was investigated, it was pretty clearly about me. This time, I think it's about you. I think it's about informed consent, health freedom, your right to privacy, and the fact that these individual liberties of yours are being eroded more rapidly than you could ever have expected. America, we're so much better than this. I hope somehow you can have a profound and reflective Christmas holiday. For me, I know that I'm worried about you. Think about it. Thanks for listening. Scott Jensen.